Hello, anticoagulants are a group of medicines which stop blood clots from forming. Blood clots block blood vessels and stop the flow of blood to parts of your body. This can have very serious effects. Blood clots can cause the following conditions: a stroke, which can cause difficulty moving and speaking, and even death; a heart attack, which can cause severe chest pain, heart failure and death; a deep vein thrombosis, known as a DVT, or clot in your leg, which can cause pain and swelling; and a pulmonary embolism, or PE for short, which is a blood clot in your lung. This can cause pain, shortness of breath, and even death. Your doctor may recommend that you start an anticoagulant if you have a blood clot or to prevent a blood clot, if they feel you are at high risk. You are at a higher risk of developing a blood clot if you have certain medical conditions. These include atrial fibrillation, or AF, which is an irregular heart rate, an artificial heart valve, certain inherited blood conditions, recent surgery such as a hip operation, which stops you moving around as much, a history of blood clots, and sometimes pregnancy. There are three main types of anticoagulation. These are warfarin, DOACs, or direct oral anticoagulants, such as rivaroxaban and apixaban, and low molecular weight heparin, such as clexane and dalteparin, which are given by injection. The type of anticoagulant which is offered to you will depend on your condition, your general health, and your preferences. Your doctor will discuss the safest and most effective options with you. The amount of time that you need anticoagulant treatment for will depend on why you started. For example, if an anticoagulant is prescribed to prevent a blood clot after surgery, you will only need treatment for a short period of time whilst you can't move around as much. If the reason for treatment is because of a long-term condition that is not likely to go away, the treatment is likely to be lifelong. For example, if you have atrial fibrillation or an artificial heart valve. There is another group of medications called antiplatelets. Examples include aspirin and clopidogrel. These are often started after a heart attack or a stroke. Both anticoagulants and antiplatelets prevent blood clot formation, but they work in different ways and are used for different reasons. Depending on your individual situation, your doctor may prescribe an anticoagulant or an antiplatelet. Occasionally, they will advise you to take both.